In the tapestry of life, where every thread holds a story, America in Black and White emerges as a haven for the voices echoing through the heart of our communities. In this podcast, we wade through the rivers of our collective experiences, celebrating the vibrant hues of change brought forth by the whispers of hope and the roars of action. It's more than just a conversation. It's a journey into the heart of our society, illuminated by the light of those daring to dream and do. Join us, and let your voice be the melody that guides us toward a dawn where every color finds its place in the masterpiece of our shared destiny. Together, let's paint a future brimming with the positives that dwell in our minds and the actions that shape our world.
Good evening, family. Welcome to another illuminating episode of America in Black and White, where we honor the voices, victories, and visionary leadership shaping the future of our communities. Tonight, we sit with a man whose life's work stands at the intersection of healing, advocacy, and transformation. In a world where health inequities continue to challenge our collective progress, Dr. Leon Maultsby has committed his career to ensuring that marginalized communities are not just seen, but served, supported, and empowered. His journey spans mental health, HIV prevention, global public health, and community engagement. From classrooms to boardrooms, from Zambia to Los Angeles, he has carried one mission: to advance equity with intention, compassion, and excellence. He is a healthcare executive, an educator, a Lean Six Sigma Black Belt, a social work practitioner, and a champion for Black communities, LGBTQ plus individuals, and immigrants. His leadership on the LA County Commission on HIV's Black Caucus is reshaping policy, strengthening community voice, and pushing the needle towards justice. Tonight, we welcome a man whose story is rooted in purpose, whose work is grounded in service, and whose impact is felt across continents. This is America in Black and White, and this is Dr. Leon Maultsby. Welcome to the show, sir.
Hello, good evening.
It's good to have you. I hope you're having a great day.
I am. Are you able to see me all right?
Actually, it's like you're frozen.
Oh, let me see. Maybe it's just there.
There you go.
No, there we go. Good evening.
Yes, sir. So, is there anything you'd like to say to our audience before we get into the show?
I'm excited to be here, talking about my different experiences. You know, I've been in different places here in California, as well as you mentioned Zambia and Florida. So I'm looking forward to getting into it.
Great. Well, I'd like to first start. Let me just tell everyone out there in the audience, those that are watching the show, that I appreciate you guys for being here. Thank you for being here. And please enjoy this conversation because I'm sure there's lots and lots to learn and there's lots that you can get from this. So let me start, Dr. Maultsby, by saying that what we normally do with every show is I like to start off with what I call your life story because I like for people to get to know you, the guest, a little bit better as we delve deep into the wonderful things that you're doing.
Mm-hmm.
So can you tell us what early experiences shaped your passion for behavioral health and community advocacy?
I would say probably the earliest thing is probably like my mother was a teacher. So a lot of things, I mean, you think about people in the education spaces, especially as young as like middle school and elementary school, a lot of their work is community-based because you're not just doing things in the classroom. You're also trying to address certain needs and certain things that are happening outside the classroom. And so I got a good front row seat to see how she navigated that space as a middle school teacher. I was really passionate about it and really passionate about people. And so I think for me, when I think about like when did I get it, when I was a senior in high school, I was taking dual enrollment classes, and during that process, I started taking a psychology 101. And I think that's where I got the bug for behavioral health and learning about how people operate in psychology and things of that nature. And working at a residential facility is you kind of see how the different systems and how people live and the different systems and how they're interacting with. And so that kind of got me more interested in more of the community work.
Oh wow! So you know, and getting that early experience and watching your mother, how did that influence you more so into education to doing the things that you're doing now?
Great question. I think for me, I was able to see how people perceived her. Because I wasn't one of her students, I didn't quite know exactly what her classroom looked like, but I knew how people perceived her, spoke very highly of her, different students, other teachers, the principals. Because oftentimes, because I was of the same age range, I would go to the same schools that she would teach at. And so I was able to see that in real time of how respected she was by students and also by fellow teachers, which often now, as a more mature, older person, it reminds me of the quote by Dr. Maya Angelou, where she says, "People will forget what you say or do, but then forget how how you make them feel." And so, for me, I was able to see from an early age how she made people feel while she was in the classroom and teaching, and also the things that she would do outside the classroom for some of her students.
So, how did your upbringing influence your commitment to equity and service?
I think some things that just are just, I think, destined, honestly. I think as I would look through my past and some of the roles I held, working in a rehab center, so working with individuals and typically in Florida, Black and brown individuals like me who are struggling with substance abuse. I worked at a drug court program as well. And I think maybe like a year into that job at the drug court program, I realized that I was working with judges that had at one point sentenced one of my siblings. I had three siblings who had all been convicted of some kind of charge, and realizing that I'm working with six judges and looking through it, I'm like, I realize that I am also like the solution to what some of the problems have been, trying to be an advocate, see like I can see what happens when they don't know about certain programs. And so for me, in terms of equity, it's more so making sure that I couldn't obviously force people to go into the programs, but making sure they knew that this was an option out there, making sure they knew that you can talk about your mental health and your behavioral health stuff. You can talk about your emotions or feelings in a safe space, and you won't be ostracized or stigmatized or judged for how you feel. I think I was able to see it from both sides, and I think that more so propelled me to be able to be more space on equity, to see how do we bridge the gap in different spaces, especially with the drug court program. We saw that there were a lot of individuals who were white, younger, male, like that, who were getting into these programs, diversion programs, very early on. Meanwhile, for people of color, we saw that Black individuals, they weren't getting into the programs until it was like later, like a violation of probation, or they had already had so many points on their record that this was a last ditch effort. And so my push was like, how do we get more people who are newly charged with certain crimes based off substance use into these programs? So I saw the need. I saw the need, and I saw the benefit of what it could do for people who are newly charged with crimes, and also I saw the detrimental portion of it for those who were given a last option with it and saying like this is like either this or prison. So you see when people have more of a earlier stake in it, their recidivism rates obviously go lower, and also when we see the individuals that are able to get the treatment early on, we see that they're also able to kind of break some of these addictions and some of these habits. So kind of seeing it from both ends helped me to like really be committed to the equity work, because I think that we often don't see that in this space.
Mm. So, as you saw that, and you saw where there was the unfair treatments and things of that nature, how did that motivate you to be more into this space of equity and inclusion, but also to give you the strength to help those that really, really needed it?
I mean, it really made me reevaluate how I was maybe approaching it, how I was having conversations with individuals. Some things like I saw my mom do with me, put things in perspectives, where she would sit me down as a very young child and say, "You can't do certain things that other children can do because you're Black." And so naturally, that was a different conversation within those in the drug court program or behavioral health spaces. But putting out there, like, there are things that we have to unlearn as people of color, as Black people, Black men, Black women. We have to unlearn certain things, especially in the drug court program. letting them know like this program's out there. It could help you if you want it to help you, but also you have to do the work. It won't be something that's just going to be handed to you. Like there is going to be some things you have to fight cravings and urges and peer pressure that will still be present. But you're able to do it. And so I think a lot of the work I had to do was to reapproach how I was having those conversations to make sure it was really hitting home, and really implanting the message I really want them to take away from it.
Okay, well, can you tell us this? What values did your mother, Mary Maultsby, instill in you that still guide your work today?
Ooh. Um, Integrity is one of the biggest things. I think we learned so early on of like treat others how you want to be treated. And so when I'm doing this work, because I encounter individuals of all different ages, and all different backgrounds and things like that. In the back of my mind, what I'm always thinking is like, this is someone's mother, this is someone's son, this is someone's father. Like, treat them how you want your, loved one treated, and that really has helped me in all different spaces. I don't really take the work personally. You may have, especially now working in this more clinical space right now, like things may happen. Patients may make mistakes and do things like backpedal a little bit in certain things, but not taking it personally has been a big thing, because that's part of a human experience. So I think for me, one thing she definitely taught me, and I still hold to me this day, is like treat others how you want to be treated, and I use that as my guiding force and my north star.
Considering the work that you do, especially when it comes to what you do here for social work, as well as being an adjunct professor, and when you think about, from the early on experiences that you had in growing up, can you tell us when you look at now compared to then, what are some of those things that you learned of that you saw as a child that you see lots and lots of gaps that need to be filled that you want to try to make that happen?
Ooh. Um, I would say probably one of the biggest gaps is mental services early on. I think right now, I've been encountering and seeing a lot of individuals who may be so far into the cycle of their, mental illness that it's hard to come out of that. And they may have already burned bridges. They may have already like been disassociated with family members. So it's harder because you really need a support system. A lot of the patients I talk to now, in my current role, is one big things we talk about is like, who's your social support? And oftentimes they don't have anyone. I would say it's like 50-50. Either they don't have it or they don't lean on the folks that they do have in their circle and their spaces. So I think more a quicker access early on to mental services, more conversations around it to destigmatize it. We think about how do we destigmatize things like HIV and mental health and all the different things that are plaguing really the Black and brown communities. It's through having these conversations because people don't know what it necessarily looks like, and so oftentimes if we don't know what something looks like, we're also scared of it because it's so taboo. So bridging the gap with that, I think also. I would say the education system, I think, is another thing. I think oftentimes, obviously, we're in this new world of AI and things of that nature, which I'm not against per se. I think it's a great tool. But I do think that, seeing things academically, even, s- sorry, seeing how things are operating in the spaces of like, how students are taught to critical think, I think has been shifted a little bit. Because before we used to have to think on ourselves. Right now we have some support. So I think there's some gaps there as well. Because I think growing up, we did see a lot of individuals who weren't passing through certain grade levels. So how do we, make sure each school has what it needs in terms of teachers, salary, to the right salary, and also equipment to teach this next generation, I think is missing.
So, when did you first recognize that leadership was part of your calling?
I would say 2016, 2017, and it really stemmed from I was kind of exhausted from having like managers who could not support me. I knew what I needed, but I also knew I wasn't getting what I needed from the particular managers I had. I felt like I wanted someone who could, if I wanted to take a week off, I could do that and not have to worry about my work piling up or who was to take on my workload. So I'm not coming back to triple or quadruple the work before because now it's, no one's been attending to it. So I was also in positions where no one quite knew what I did, but I still had managers. So when I kept seeing that, I was like, well, I want to find a way to change that. And so I got my first opportunity working at a nonprofit to be a program manager. And really, what was my guiding force with that? I was like, what did I want my previous managers that I never got? So I allowed that to lead me in the different spaces. So I was more attentive. I was doing one-on-one sessions with the staff. I was also trying to make sure that we were leveling up the staff. So if there are things they want to work towards, how do we accomplish that? That was my main focus. 'Cause I realized I wasn't getting that as an employee. So I was trying to kind of be the change, as we have to talk about with Gandhi, that I wanted to see in those spaces. And once I got a taste of like leadership and realizing that I could be part of like the think tank to get certain things done, and that was more not for some people. For me, it was more impactful because I could then encourage the staff to do the different things, and we can cover more ground as opposed to me being one person trying to do it as an employee. So I saw more power in it a little bit with leadership, and also the ability to kind of cultivate and build up staff to where they may have started at one position when they one part when they got there at the job, but how do we elevate you beyond that to really see your potential? So that was, kind of getting a taste of a little bit of the nonprofit only propelled me forward from there to kind of see how do we think of things on a bigger scale.
So, what challenges did you face entering the healthcare field as a Black man?
I would say on one as a Black educated man, there was a lot of barriers. I think there was my early spaces when I was working at the first I worked in a hospital in Florida, a lot of condescending things that I would get from different staff as well. Again, I my structure, who I report up to, is very different from some other staff because I was more so in charge of the legal process, and so I would get a lot of very condescending messages and comments, and having to negate that. I would also say that one thing was like imposter syndrome hit very hard. By the time I started working in healthcare spaces, I'd already had my master's degree. I'd already had years of experience in healthcare already. And I don't know if there's ever a time where you think like you're really ready for something, ready for a position, ready for the responsibility. And I remember when I started that position, it was in August of 2015, no, August of 2018, that the persons that were training me on my third week, they wouldn't be there. So I would be in charge of this entire process for this week. And kind of like my previous manager, she was transitioning to a different role. So I knew I had limited time, and I knew something was going to happen that week that I wasn't going to be ready for. And it did. And I was able to navigate it very seamlessly, I feel like. And we were able to get everything situated. I called on resources. I'm very resourceful in that capacity. I remember calling different hospitals around the area to kind of see and kind of like compare how they would handle a situation. That role was really based on some of the mental health law in Florida. So naturally, reading the law and statutes was really my big resource as well, and how I interpret it as well. So yeah, imposter syndrome as well as condescending behaviors. Also, I was very young. I mean, I'm still very young now, but I was very young to be in that role. And I remember at one point, my director at the time asked me how old I was, and he prefaced with saying, "Well, you're not gonna get fired because you still work here, but I'm just curious." And I told him my age, and he was like, "I'm double your age," and I was like, "Yeah." And he didn't know. I mean, I'm obviously can't tell him this, but I'm 6'2", and so like I guess the way I carry myself, and obviously like the bald head, I looked much older than I was at the time. So those are two main things I faced coming into healthcare spaces. Yeah.
So, how did your academic journey shape your worldview and professional identity?
Um, I think my academic journey was really an homage to my mother. My mother, she graduated with her master's degree in education, and so growing up, I knew I obviously wanted to go to college. I knew that at the bare minimum, I should get a master's degree to match what my mother did because she set the bar there. I don't know if I saw myself getting my doctorate in behavioral health as an adolescent, as a young adult. That wasn't really on my bingo card, if you will. But I think what it has allowed me to do is see different spaces. So from my psychology bachelor's degree to healthcare administration to see how, especially at the time I did my master's, first master's, to see how to handle things as a leader, healthcare administrator, as a leader. What do you do with the budget? What do you do, when there's a crisis with the hospital? What do you do in these moments? How do you quickly think? How do you come to a solution really quickly? How do you stand out in the room and listen to all perspectives and then make an informed decision. So I learned that through the practical sense of the academic process. Then also working within hospitals, I was able to apply that. And so that was really beneficial to make sure. And I really was able to use that at the hospital because I was able to be in the room with the lawyers and be in the room with the psychiatrists, social workers, and they're looking for me for advice on how to deal with situations. So at times that could be very nerve wracking because it's a lot of pressure, but I was able to really tap into that because academically it prepared me for the hypotheticals that I would have faced professionally. And again, the integrity of just making sure you do the best into what you can do. You know, you think things through, you make sure everyone's getting what they need, but the same token, realizing that you also could make mistakes too. So how do you navigate that space was a little tricky, but I think academically it prepared me through a lot of the different scenarios that we would face in the classes, especially my doctorate program.
So, what moment in your life felt like a turning point toward purpose?
The first moment, I would say, when I was working at a rehab center, I was there for 10 years. And so I started working there when I was 20. And there was a particular patient who was, she was, I think, I want to say she was like 16, 17, a very smart individual, but she was also taking like dual enrollment classes. So while she was on the same unit as like middle and high school students, because of her age range, she was still in classes with them. So she was still in a unit with them, although because they're the same age. And so I remember she looked at me one day and she was like, Mr. Leon, what do I need to work on? And I was like, you know, I think you need some humble pie. I think that you have a space to where you know you're on college campuses, but also here you are just like the rest of your peers. You know, academically it doesn't make any difference between the two of you all. And so we would have really detailed and challenging conversations sometimes where I was trying to like really push her to be more humble. I mean, it wasn't until years later where I saw her back at the administration office, and she had said that I was one of the reasons why she was still sober, and how she was teaching classes locally, and also how she was um, doing the AA groups for the young adolescent girls then. So I realized in that moment, like you don't always see the fruits of your labor in the moment, but sometimes the years later where it comes back and reminds you of it. So that was one of the biggest things where I was like, you're in the right space, you're doing the right work, and your method is working and effective.
So, how do you stay grounded while navigating high impact, high pressure work?
I don't take it personally. That's one of the biggest things I don't do because that can make, you know, things so stressful, or more stressful, I should say. I also have a good support system. I have good family and friends. When I actually need to get some advice on something, whether personal or professional, I have a good network of people I can contact and kind of ask certain questions to. And so that's been a really saving grace as well when you have individuals who are in similar spaces in academia or higher ed, business positions or leadership, you know, you're able to kind of, you know, throw ideas around and see what they would do in those moments. And that's been very helpful. So it keeps me very grounded in the work, especially when you're able to talk to your colleagues about it, who are at your level, and get their feedback. So that's been very transcending.
So, what role has mentorship played in your development?
Ooh. Um, I don't know if I've had like direct mentors. I feel like for a lot of different works I've been doing, I've been kind of like forging my own little path. I have been able to see what I don't want to do. So I've been able to like be really observant of people who are in different positions. Um, and so I think the biggest thing I would say for mentorship, when I worked at the university, in each of those positions, like there were individuals who I didn't know certain things, so I was very inquisitive. So they really created a space for me to be able to ask questions. In those capacities to really become like a subject matter expert on that particular topic, and that was really needed for me because I would be the first person to say I don't know something, and I'll ask questions so I understand it. You know, I try to maybe overcompensate to make sure I get it, make sure I'm aware of it because if I'm asked a question, I want to make sure I can answer it and articulate it very clearly. So I've had a lot of good mentors in that capacity who've been educators, for lack of a better word, either through professionally or also through some of the patients. I talk to different patients, like their lived experience that also I lean on as well and hear from because how they may encounter a certain situation or circumstance may be different for everybody else. So even when I'm talking to patients now on the units and I'm asking certain questions, I'm able to like put those different things away and kind of hear their different stories of what is their driving force and what helps them and what may help them may help the next patient. So I look at it from both ends in that capacity as mentorship.
So, what does resilience mean to you personally?
This is a good question. I've also had this question with one of my good friends, and we talk about does resilience, can you be resilient without going through a traumatic experience or something happening that almost like it's a muscle? And that's what I feel like it is. I think resilience is a muscle that has to be worked and tried to make sure it works in some capacity. I don't think everyone, unfortunately, has the capacity for resilience at every level. For me, it's a survival technique. It's been how I've been able to get through certain situations. It's a physical thing as well sometimes. How do you physically process certain things as well as mental as well? And I think for me, mental stability is a really critical thing to be able to emotionally process situations and your emotions and be able to put those in the right place and compartmentalize it as need be and then address it when you need to. So resiliency, I think for me, is a really huge survival skill that's needed.
Well, it seems like, that you have not just resilience, but you've got this calm. And I'm
Mm,
trying, and I'm just like, you're just like this.
yeah.
So, I mean, you've got to tell us, how do you do that?
What's funny is it was maybe a couple months ago, a patient was like, "How are you so calm?" And he was saying that we're in the middle of a group and he was just so elevated. And I was just like, I really attribute it to working with adolescents. I remember there was one particular time this one young boy was struggling and was screaming profusely. And we're in a calm room and he was everything but calm. And I just remember sitting there and like at some point trying to disassociate like from this moment, like while I can still hear him, not give that much energy to it. And I think eventually he was able to stop. But it required me to be able to like disassociate in a moment and be like, how do let me emotionally regulate. And I think I'm really good for the most part. I'm a Pisces, so I have my little moments, but for the most part, I'm really good with emotionally regulating because I realize that if I amp things up, then it's going to be bad. If we're all amped up, nothing's going to be solved from that situation. I think with me not taking things personally, it also helps too. But I'm really good in chaotic situations because I'm just instead of reacting, I'm more so thinking like, what's the solution? Like, what's the issue here? And I typically go in most spaces mentally thinking like that, and that helps. But I'm not always calm, but I would say 99.9% of the time I'm really calm. There's that 1% chance, but for the most part, I'm able to just disassociate and kind of figure out what is needed right now. Is someone not being heard, or what need needs to be met in this moment to de-escalate? But I think working with adolescents will teach you a lot about yourself. And if you can't do with adolescents in terms of staying calm, you probably won't, mental health may not be in the right space because you have to be ready for anything.
Let's talk about a little bit about your education and scholarship. What inspired you to pursue a doctorate in behavioral health?
It may have been, as you asked earlier, what were some of the barriers of getting into the healthcare spaces? I think for me, it was I saw that white individuals were being promoted and white individuals who had less credentials were being, sought after for different roles. And I felt like I already knew what I was talking about in terms of the court process and the legality of the my role, but I wanted to be an expert in that particular topic and that particular space. And when I was looking for a program, I didn't just want to find anything, but I found a program that really merged what I was doing. It was integrated behavioral health. So how do you, merge behavioral health with primary care settings, and how do you meet the needs of these patients with these two different arms of medicine? And so when the pandemic hit, and I was like, well, what else am I going to do? And the program came up. It was through Arizona State University. I was like, this is a good opportunity. And so I felt like after doing the program, I would have the capacity to be an expert in behavioral health and how you integrate also some clinical pieces as well, but also be able to take on those roles and do advocacy and policy work that look like what I wanted to see change in the spaces. So that kind of propelled me for the program and it kept me going over the course of those, 4 years.
So, how does your psychology background inform your leadership style?
It really informs on how I interact with people. I also realized, and when I was especially at the university, you would know it, but also I guess processing the fact that when you're a leader in a department, in an organization, you're not looked at as being human. You know, obviously they know you are human, but like it's not like, oh well, there's consideration because you have other things you have to do. It's like no, like it's almost like I can't come in today, figure it out. And it's now you're left to scramble. And so I feel like my biggest one of the things most proud about working at the university was how I was able to shape the culture of the staff there. It's still different things. Also, like, you know, you have to change how people perceive their role and make sure they have some buy-in for their role. But also, how do you interact with other people as a unit and as a group? And how do we work and hand off things? So I think the psychology degree has helped me to be able to better communicate with individuals, know when I need to step back and let them speak and kind of hear what the need is and try to meet them where they're at as an employee relationship, and also make sure they feel affirmed because that's I mean they also say people don't quit jobs, they quit managers. So I wanted to make sure that I wasn't the manager that was not listening to them, and the psychology degree helped me with that tremendously.
So, what motivated you to pursue a Master of Social Work at this stage in your career?
I wanted the clinical experience. I've always considered the social work degree, and I was also thought I would be good with in the clinical space, but I had a different perception of what the social work degree would do. I think early on, when I first started working at the rehab center, I thought of the social work as just someone doing 1 hour sessions with patients, and that's it, or 2 hours a week with a patient and their family is additional hour. And so I didn't see the global impact that a social work degree would have. And I have a best friend who he has his master's in social work and he's a licensed social worker, and also he has a doctorate in community college education. So our experience was very different because I mean he was in a clinical space, so I didn't have like the full space of knowing the really the big social justice arm that social work comes with as well, in addition to clinical. So you really can be in different spaces and how it also can inform policy. And so last year, I actually applied for the program last year around this time and got into it for the fall and deferred for a semester. But I figured it was time for me to kind of get more in these spaces for clinical expertise. And also, I feel like a lot of things I'm seeing as a black man, as a black gay man, I think that we need more to take up more spaces in the therapy space. As a black individual, I want to be. I'm not sure exactly what that looks like when I'm done and what kind of population I'll work in. But I also want to be a representation of what it means to provide that service.
Well, let me tell you, I think, you're definitely exemplifying and being that is what you want to see. But I want to ask you, do you think that maybe that you're going a little bit too hard and too hard in the paint, maybe, because, like at some point, when you actually are putting up all of these top programs that you're in, and you have to be so meticulous and detailed in each. How do you have time for yourself?
Good question. When I was in my doctoral program, I definitely made time. I was very intentional about making time for relaxation, and friends and family. So I was definitely intentional about that. This program, it's a shorter program, so it's like I'll be done next May, and also it comes with internships like that. So right now, I have to get more creative because my time is more limited now. But I find small things to be able to do certain things. So I still make time for myself. And I think I've been very fortunate, even with this, like I have to do an internship with this master's program. I have an internship that's really flexible with my schedule. I'm able to do certain things and do the things I want to do. So I think when your work is driven by passion and purpose, like it's easier to kind of get out of bed and do it. If I was at a site that I wasn't really bought into, and I actually had the opportunity to go to a different site actually before I chose it, I could see that I would be in that space where I'm like, it's a struggle to get out of bed, a struggle to go to this, this site every single day. But I'm really passionate about my work, so that definitely helps. Passionate about people, so but I also recognize that it's also a short-term program. If this program was 3 years, I probably wouldn't have done it. But it being 16 months, I'm like, I can do that. It'll be over before I know it. So that helps to push me forward with it to where I can still balance a personal life.
So when you think about psychology,
Mhm.
you know, and with this comparable part of what you do in social work, can you tell us what is it about psychology and the relation to people and your advocacy work that makes you stay so focused and so driven and stay at the top of your game?
Um, Psychology for me is really like the study of like obviously the mind, how people operate, and being able to see that connection with social work because then you see how people operate as an individual and also how they behave in different communities that they may be part of, the different systems, and we learn about that in the social work program. Is really interesting. You see how I would say, for instance, I mean, off the top of my head, I'm thinking about like Barack Obama, how he operated before as a lawyer just in Chicago, then how that manifested to like his outer ecosystems and how he was able to then transcend that to be obviously the president of the United States. It starts at the beginning portion. So how you act as an individual and also how people receive you. And so I think when I'm doing this social work program, I'm also seeing the different capacities, intersections with social justice, policy, and clinical stuff, psychology is at the heart of all of that.
So when you're actually interacting with the community and the people that you're working with when it comes to your advocacy work, can you tell us, like when dealing with these individuals, what is your approach to these individuals and what are you seeking to get as a result of your interaction?
Yeah, I would say clinically, when talking to patients, I found that I try to do more listening than talking. I do also like the reflective listening, to where like I might repeat back what I heard, and understand like their experience of it. A lot of things I do is also in group settings here, so a lot of it could also be making sure people understand like two things can exist. Like you both may be dealing with, let's say, bipolar, but how their bipolar presents for them may be different than yours, and both are very valid without having to be in conflict with each other. So I'm mindful of that, of just being a listening ear. 'Cause I think a lot of times a lot of patients want to be heard because sometimes they're not heard, or people are intentional to kind of understand how they operate and how their mental health may impact how they operate. Well, I think it's one of the work I did with the Black Caucus. We've done several listening sessions over the course of the last 2.5 years, with different demographics and different people, from trans women to intersex men to non-US born immigrant communities to the faith-based community, to non-traditional providers. And most recently this January, we did the final one with the youth. I feel like in all those spaces, people want the same thing of like being heard, but also the opportunity to tell their story and tell their lived experience. Oftentimes, we think about, you look at a tombstone, you see like the birth year and their passing year. That dash is like their lived experience, and that's really impactful for a lot of individuals. And a lot of times, people want to share what their experience has been. And so, I think with listening sessions, I've done the Black Caucus in the community in Los Angeles. A lot of it is like they want to share their story and their what they've gone through, because it matters. And, that's how we continue our legacy on. So I feel like being heard and passing on one legacy through storytelling are two different things I have found is needed in those spaces. And I try to be that for individuals and give them that space to do so.
So how do you integrate academic theory with real world community needs?
Through the data, we see naturally the academic portion will kind of tell you like best practices. And so understanding that while that may be, have been studied, obviously tried and true, not all of it will apply exactly to the practical sense when you're trying to implement it. And so taking it in strides, so just not almost piecemealing, but trying to see, let's say, if this particular I would say one thing I'm looking at now is organizational assessments. We know like these things have been studied academically, how these things operate, but also understand like this whole like I'm looking at now one assessment in particular, like this won't apply for the setting I'm in now. So how do you modify this and or how do you find a different one? So looking at the data to see exactly what this is best used for, and maybe not the whole thing may be best for it, but portions of it. And so I think piecemealing in that capacity is critical to understand like not everything's going to apply. We think of a lot of things within the Black and Brown communities. A lot of theories, even clinical theories, aren't really applicable or haven't really been studied to its full degree with people of color, Black individuals. And so letting that be the guiding force behind it as well, and understanding that there are other things at play that may impact it, that have several conversations about clinically as well.
I'm going to ask this question first, but I'm going to come back to a follow up on that because that's a really good point that you just made there.
Yeah.
What do you believe is missing from traditional healthcare education?
Patient stories. I think whether it's a clinical degree or admin degree, I think having more patients' lived stories shared in those academic spaces. And that's similar to what we were doing at Charles Woodson University, part of when I was as assistant professor with we were having our patients from the clinic come in, talk to the medical students to kind of show them and tell them what they're going through at different stages of their journey with HIV or substance use or how being unhoused and things like that. And so that puts things in perspective. I think when we think about even things down to policy for hospitals, maybe even having patients talk about how these particular policies impact them, even down to, especially I'm thinking administratively, when you have a couple who may not be married and one may get really sick. How does that spouse who's well care for that loved one as they're transitioning or, getting ill? So I think having patients share their lived experience from a clinical and an admin role would probably be the best thing to have in these healthcare spaces for academia.
So, going back to when you were talking about, when they do this research and all these little clinical trials and things of that nature, and it's done with the premise of not the inclusiveness of Black and Brown people.
Mhm.
And so when you see the different things that are happening, all of these synthetic drugs that they're creating now, that's really have got worse side effects, okay, than the good that they supposedly do. How do you actually have the conversation or have the sessions with those people that sometimes have to go on these different drugs, but then also if you think about it, when you think about how it could adversely affect them in the worst way, how do you control that and get that in and sync it to the way that you're comfortable?
Yeah, I think a lot of the times, I mean, it's really having the conversation with the patients, understand like it should be anytime they're talking to a provider, a prescriber, it should be a collaborative effort. They should be well informed about the medication, side effects, be very forthcoming what other medications they may be on or substances they may be using, to then allow that prescriber to then make the best informed decision for them in terms of like, we think we recommend this particular drug regimen, if you will. But that patient should be well informed about what the side effects may be of that medication, and how that may impact them. That's, I mean, the same thing we see in clinical trials. That informed consent process should be very detailed. And so patients should have autonomy to know, like, if this is my only option, then that's one thing. Maybe also get a second opinion. But at some point, some medications have a side effect, and I really can't do anything much about that. But understand like the pros may outweigh the cons. And so in that situation, having that conversation was really critical. And obviously, especially in the healthcare spaces, hospital spaces, having a social support, like a therapist or social worker there to kind of bridge the gap to kind of see where that patient is in terms of their readiness is critical as well.
So how do you teach students to approach health equity with empathy and strategy?
One thing I know with to really be immersed in the community they're in. When I worked with the medical students, and we were talking about the obviously health disparities in that particular area. We pulled some of the data from LA County to see in this particular area what were the most common causes of death. what conditions were they, what like lifestyle choices were they. There's a lot of different things that are in the particular area that people can utilize as a resource. So one particular portion I remember was like, I feel comfortable walking down the sidewalk in my neighborhood. And I think only maybe like 35% of people said yes to that. So even seeing that as a provider, that you're able to then say like, well, maybe that we're in an unsafe area, or these patients feel like they're unsafe in these areas. That may also come into this clinic space. This may also come into the provider's office. So how do we make sure we see this person as a whole person, not just a piece of it? They're not just here to treat their hypertension or their diabetes or even like their HIV or obesity. We're here to treat them as a whole person. What referrals can I provide you? You said you felt unsafe in this particular area. Like, how can I provide you with social services to get you housing, or is that something you're looking for? So I think looking at the whole person, I think sometimes people and providers look at them just what you're there to treat, your chief complaint, but you're more than just that chief complaint, what brought you to the hospital, and allowing providers to think outside the box in that capacity.
What is the most rewarding part of being an adjunct professor?
Just that, maybe providing the opportunities to then have these aha moments with some of the students has been really enriching. Things they wouldn't consider, think about. Being able to show how we may have had a very complex patient and how we're able to get that patient's needs met has been really nice. The questions they have, and just like you could tell when people are happy and enthusiastic about what they're talking about, because the questions will come up and you're able to kind of like almost like volleyball and see the ball go back and forth. You kind of have that with the academic spaces and really kind of like flourish that when they're curious about that. So curiosity is really a beautiful thing with students, and being able to water that.
So, how do you prepare students to work with marginalized communities?
Bringing them into the spaces. We were fortunate to have certain patients that really were advocates for the particular condition, so they felt very comfortable coming in there and talking to some of the students. And so I think that's one of the biggest things. I think also sharing with the patient, like, these patients are no different. The students think, they may. You often see sometimes like the worst scenarios in certain areas. Like, you think of the merch room, you think of like a psych crisis unit. You see like the very severe cases, but that's not for everybody. But also, you never know what someone's going through. So I always try to make sure we ground the students in knowing that like these patients have a lot going on before they come through the door, and so treat them as such. And it also, we have to talk about how it starts at the reception office. And so if that bad experience in the reception office is, if that experience in the reception office is bad, when they come back to see the nurse, when they come back to see the provider, it's going to be even worse. That patient may be livid, or they have checked out and not really trying to buy into the healing process. So being mindful of that and like understanding that these patients are just humans, and they need the same level of attention and care we want to give our loved ones as well.
What innovations in behavioral health excite you the most?
I would say there's been, and it's not really an innovation, but I think there's been a bigger push towards talking about mental health, probably since the pandemic, in the Black community. We have a lot of Black individuals, Black celebrities who are talking about, their depression, their anxiety. Most recently, we saw Lil Nas X come on his social media live and talk about how he was diagnosed with bipolar, and what that looks like. And I think sometimes we are so quick to write individuals off. And so I think the fact of sharing stories makes things less taboo. So I think that's probably one of the biggest things I really appreciate over the last 6 years with the pandemic, is that people are sharing their experiences, and it's no longer like, a taboo situation. Mental health, depression, anxiety, being on medication now. People are talking about it on social media. People talking about it in like panels, conversations, conferences. So I think that's been the biggest thing I've seen recently that I'm really appreciative of.
So, how do you define culturally responsive care?
Culture responsive means you're doing something about it. It's beyond just knowing that, Black individuals may be disproportionately impacted by the criminal justice system, social justice system, healthcare, some of the conditions, diabetes, HIV, Black women with mortality rates for as they're giving birth. It's beyond just knowing that. That's being culturally aware. But how do you respond to that? How are you asking the questions? How are you doing the full comprehensive assessments? How are you really asking women about their pain levels or really assessing them? um, I guess the equality portion of it is like, am I asking everyone the same questions? With the equity, it's like, because I know you may be part of this community, let me make sure I'm covering all my bases. And that's what we need with equity work, especially as in terms of behavioral health. Is like, how do we make sure we're approaching all situations with this and seeing this patient as a fully rounded individual and responding to it beyond just saying, well, we're aware you may cook this way, but just try this little DASH diet. It's like, well, we may need more resources beyond that.
So, when encompassing all of these wonderful things here, especially what we just talked about here in these last 15 minutes here, can you tell us how does that fit into the work you do as an advocate? Because being an advocate, we know that that's like, oh my God, that's like being the savior. I'm sorry, I don't want to take that out of context, but you know what I'm saying, because that's like being
Yes.
Jesus Christ. And so when you're doing this advocacy work, and you're working with the community, in the best way, you know. And I think some people don't take advocacy that serious. They just want to say, "Oh, I'm an advocate," but they can't really speak to it.
Yeah.
When you're doing this, like, what is it that makes you get down into that real grit, that really let people know I'm here for the long haul and I'm here for you, and this is why?
I think what I see the impact of when we don't push hard for certain things. We all can't have the same causes. There's some things that I may not be passionate about that other people they pick that up and they run with it. Behavioral health has been a long thing for me for at this point almost 2 decades. And I think what gives me the grit for advocacy is like understanding that me not doing something can cost people lives. Having these conversations really expands people's minds and mentalities. I know often, even like last year, I lost my cousin to suicide, and so even thinking through that and his circumstance, and as I processed that passing with grief and all the different things, I was able to realize like there was so much legacy there, so much story there, but also like mental health is really really real. So we don't share these stories, we often miss these opportunities, and we never know me sharing something about how you become intentional about having conversation with people and holding space with them can save someone's life. And so we often think that it has to be this big grand gesture, but sometimes it could be as simple as pick up the phone, or if you have the intuition to call someone or check in on someone, to do that and not allow these frivolous things like work and other things like get in the way of real human experiences. So I think what grounds me in advocacy is understanding that these are real lives out here that we're changing and facing, and people have real problems, and oftentimes we don't have the safe spaces to address it. And so if I can do something to bring someone else's story into the room, into the conversation, I think I would do that, because I think when we share it, people also see themselves in those situations, or they see their cousins or their sisters or their mothers or grandparents. And so I think when we're able to do that and connect folks, we see a bigger system being formed.
Let's talk about your work as an adjunct professor. What teaching philosophy guides your classroom?
I would say one thing I'm also like I press upon the students, especially with talking because a lot of everything I do with the students has been around sexual health, HIV, Prep 101, People First Language, things like that. And so I think having the spirit of curiosity has been a big thing. I was like, you never can assume something. I know I had one staff member one time share with the students that she forced her doctor, although she's been married to her husband for decades at this point, to ask her about her sexual history. Because the doctors assumed because she was married, that was just her one partner. So I often try to impress upon the students is like have a spirit of curiosity. Let that lead you. Don't just take certain things at face value. And you never know. You may see someone else. You may see someone like me, dressed in a suit, obviously beard, bald head, and may go by she, her pronouns or they, them pronouns. Like you never want to assume. So you always want to ask questions. So having a spirit of curiosity to ask questions to get as much clarity as possible so you can treat that patient in the way that they need to be treated, medically and personally.
How do you bring lived experience into academic spaces?
Hmm. That's true. It's a few folds. I know a lot of times during faculty meetings, being a younger individual on faculty within the university, I would bring my lived experience as a student in terms of like, as we'll talk about, how do we market to students? How do we get more students in these spaces? So I would bring my lived experience of like, what I would perceive as someone who's younger to want to see on a campus or kind of experience as a student. And how do we make that happen? From social media to events on campus, so I'd bring that experience as well. Academically, the same thing. I would often share, when appropriate, different experiences I've seen in different hospitals, different community settings, into the classroom settings to provide one, the theory, but also the practical sense of how it may look for them. So kind of both. Applying that was very helpful, and they're able to ask questions, and we're able to kind of engage in some really good dialogue with that and see how um, it gets impacted.
So, what do students often misunderstand about public health or behavior health?
With behavioral health, I think people misunderstand like the nuances of some conditions. People think, oh, because you're depressed, it just means you're sad all day. Or they're misusing the word depression. A lot of students think, oh, well, I just had a bad day, or I failed a test, I'm depressed. It's like, well, you're not clinically depressed. You just had a bad day. Like you can have a bad day. A bad day doesn't mean you're depressed. I think also with public health, there's still this notion that certain conditions are only for certain people, and not realizing that there are men, women, black, brown, Hispanic, white, of other races who are living with these conditions, and are also more at risk for some of these conditions. I think that's also missed with a lot of the students is like they think that that there aren't like white individuals with heart disease. Everyone is impacted by these different things. It really depends on, when we look at those social determinants of health, obviously like where they're living and residing at also impacts on that capacity as well. So how do you assess all of that? But I think a lot of people still think that there's certain conditions only for certain people, and that m- mental health and behavioral health is just black and white, that there's no gray area in there or like nuances with the conditions, especially when you talk about like complex traumas, complex PTSD, how that might show up, and also like when you have different things at play like anxiety, depression, and bipolar. How do you navigate that? So I think they just see a lot of things they see on TV, and they don't know like it could look very differently in practice in real life.
Well, I want to tell you this. I think that as a young man, you really represent the LGBTQ community in its highest form and its highest standard. And that drive that you have, I hope you never lose that, because right now at this time, as you're talking about social health, public health, and you're talking about these things that are happening from both public, private sectors, and just all forms of life. Everybody's touching certain forms and fashions, but when we think about the underserved and marginalized communities, I think especially from the black and brown perspective, to have somebody that's an advocate like you, it really sheds some light that not only is there somebody that cares, but someone that knows.
Mhm.
And so when you think about that part, can you tell us, how do you encourage the critical thinking around the system inequities?
Asking why. When I come to new places, like, why do we do this? Are we open for feedback? Can we change this? I think that, and how do we make this better? Are things I ask in these different spaces to challenge it. Right now, I'm doing my internship with a post-incarcerated nonprofit. So they provide housing, legal services, free of charge for some of these individuals. And so that's been my guiding force since I've been there. Is like, why? How does this work? Okay, how do we work together? How do we, kind of like how do we build this collaboration amongst different teams? So I think because if we're not in sync, if we don't have things flowing as they should be, then we could see a lot of, more gaps and more things coming out of that. So I always ask why, and try to challenge that. And that served me well in the last couple of positions I've been in, because it allows others to kind of explain kind of the rationale how it was. And also them also saying like, we're open to change, we're open to new ideas, and then inserting those new ideas in there. So that's been the biggest thing I've done recently to kind of see how we can bridge the gap with some of these inequities in the systems.
So, what is one lesson you hope every student carries forward?
That if you're thinking in the question, someone else is probably thinking the question as well. To ask the question, take up space. I think oftentimes we are, whether because of we come from marginalized communities, or because we have the imposter syndrome, we don't think we should take up space. But understanding to take up more space in this, wherever you may be residing at, wherever you may be occupying, that take up more space. Ask the questions. Throw your ideas out there. Not everything's gonna be perfect, but again, it's like building a muscle. The more you do it, the more comfortable you get doing it, and you can sharpen that skill. But ask the questions, make the comments, give the suggestions, take up space.
Um, how do you balance academic rigor with compassion?
With grace, I would say. For a lot of individuals, academia is a way out of their particular circumstances, especially talking about healthcare. And so I think that being able to piecemeal it and kind of like take the different degrees, take the different programs, the semesters in stride and like as in bite sizes. Really keeping your why at the forefront, I think is also really critical as well in terms of how you bridge the two between that. Because as we know, being in academia as a student, as a professor, is also very grueling as well. So being sure about why you're doing the work is really critical to maintain that compassion with it.
What topics do you believe should be mandatory in health education?
Topics in health education, I would say how housing impacts health, mental and behavioral, so survival techniques. Really things around sexual health as well, from a universal perspective. I think sexual health is really critical. Um, and how policy informs healthcare. I think those should be topics that should be touched upon in every curriculum.
So, how do you support students who want to work in community based settings?
Hmm. I think over explaining kind of, I mean, we work with a lot of students who are coming to our clinics and our different hubs within the university for HIV testing. And one, informing this, obviously the participants what's going on, so they're aware of it. But I think getting a space where you kind of walking through the student exactly what you're doing and why you're doing it. So getting comfortable with that, I think has been really critical. So they understand the why behind it. So um, then they can ask questions. They can ask the why questions and how does this operate in this capacity questions, to where they can be better informed as well.
So, what is the future of behavioral health education?
The future of behavioral education looks like integration. I think, yeah, integrating in different spaces and really making sure that we have these primary care doctors aware of how mental health conditions impact the physical health, and how to have quicker access to behavioral specialists in those different primary care settings. I think it looks really integrative in the future.
Help me out here because I may be a little off on this, but when you mentioned the integration part, it just made me think of an article I just read a couple of days ago, and it was the subjected thing about it was about Black healthcare professionals, doctors and nurses,
Mhm.
and it stated that this unbelievable system here in America has done a thing to tarnish professionals that are on the ethnic side of the different parts of healthcare, and how it's still to this day is still affecting not only the patients but those professionals, and as many of them get into it, it seems like a lot of them are not completing this. So when I hear you say integration, do you think the integration of doctors that look like you and I being in a setting in which you're talking about now could make things that much easier and better for people to not only feel comfortable about their care, but to frequent and come to those establishments?
I do think so. I think a lot of people, and myself included, I look for providers that look like me, and so that's really important. While also understanding that that's not without its different struggles for those providers. And as you mentioned, systemic racism is still running rampant in just about every system, including the healthcare system. And so that impacts down to the medical students, down to the PAs, nursing students, residents, fellows. It still impacts that work. And so I think the beautiful part I've seen is that when you have attendings and you have physicians who are seasons who are mentoring the students coming up, we've seen the best rate of success with that. But a lot of the conversations, unfortunately, looks like just kind of like, get through it. Just gotta get through it, get to the other side of this, and obviously, we need more providers of color to see our patients and have that, shared experience with the patients, and patients are looking for that because we know that oftentimes, like let's say like white physicians are missing certain things with black patients, and so we still it's very much needed. And I think there's room for it, and it's necessary at this point for the survival of a lot of different individuals.
So, how do you measure success as an educator?
I feel like that's hard because I feel like it's almost like what I mentioned earlier with the resident who came, the patient that came back years later saying how, our conversations impacted their sobriety and kept them sober for years. So I think it's stuff like that. When you see students paying it forward and you see students engaging in the patient care that is equitable and needed for the particular community they're working in, or they have those aha moments, or they're doing these amazing like research projects or articles they're writing. I think that's how I would measure success, in seeing them take the torch and run on with it.
Let's um let's talk about your work with the Black Caucus. Can you tell us what does it mean to serve as co-chair of the Black Caucus?
Yeah, so as coach of the Black Caucus for the last 2.5 years, it's really been how do I bring this group together? So the caucus is a subsection of the Commission on HIV, in which I maintained the provider seat on that within my role at my employment, through my employment. But the Black Caucus, it comprises of people from the commission, but also people from the community as well. So you don't have to be part of the commission to be on the Black Caucus. And so our goal was to how do we uplift Black providers, Black stakeholders in this community doing the work that with our patients, while also uplifting the patients as well and educating them as well in terms of certain things happening in our own particular areas. So that's why the listening session was so critical that for us to do that in South LA and be intentional about the people coming to those spaces. And so the Black Caucus looked to just hold and take up space in our areas and not be specific only to HIV, but more so health in general and how do we navigate these different spaces. It was really fruitful, and that's a really a good program. I guess the department, if you will, or team, because it's been functioning very well for the last couple of years. So it's good to see that we've made an imprint in the community. And as we do more listening sessions, we also then expand our network of people being aware of the work that we're doing and coming on board with us as well.
Okay. What disparities are most urgent within Black communities regarding HIV?
We're seeing obviously high rates still within Black males, but also Black women as well. We see also how the housing is impacting these individuals and substance use, specifically here in LA County. So trying to make sure that women and men know about PrEP, pre-exposure prophylaxis, ways to take it, ways to get prescribed. Has been a big push for the last, I would say, um, and the HIV epidemic came out, I think it was like 2016, so almost the last 10 years.
How do you approach policy advocacy with community voice at the center?
Ooh. with their stories. That was one of the biggest reasons why we did the listening sessions, because every so often you need to tap back in with the community and hear from the masses in terms of their experiences with different things. And so that's why we chose different demographics as well. So their lived experiences, things we heard either tangentially or we got in reports, we're able to then use that information as we wanted to advocate for policy changes. And that was the biggest thing, because the HIV Commission is a Ryan White federally mandated planning body. So that's how we're able to dictate what the funds looks like in LA County around HIV services. So hearing the actual lived experiences of patients and different individuals in the community informed of how we were able to allocate some of those funds for different areas.
What success has the Black Caucus achieved under your leadership?
We have completed, again, the 7 listening sessions and have been able to do reports with that. I think we also have had 3 very successful, well-attended World AIDS Day events, which is honored on December the 1st. We don't always do it on the 1st, but we've done that in collaboration and under the support of Supervisor Holly Mitchell in LA County. And so well attended, where we're able to recognize change makers in our community, people who are doing the work on the ground and engaging with patients or engaging in advocacy from a patient perspective. And so it's been a phenomenal experience the last 3 World AIDS Day events we've been able to put on.
Well, something of note, and I'll just say this out loud because I think I've said it before, but I'll tell you this. If you would take the time, or somebody from your group could take the time, go to my site, Changing Trends and Times, and you're able to nominate a change maker, and I highlight them for a month, with the work that they're doing and everything. Because as you mentioned, that definitely makes a difference, because I'm about to do a big one for some educators now. And so I think it's really important to get that work out so people can know what's going on.
I definitely will do that.
Can you tell us how do you build trust with communities historically harmed by healthcare systems?
One, I mean, acknowledge the harm that's been done. We talk a lot about done a few different mental health workshops as well. We talk about these different things that have happened, from Tuskegee to Henrietta Lacks. I mean, you name it, where Black women are being sterilized against their will and unknown to them. So acknowledging the harm is the first thing. Trying to then educate us with things that have happened since then to right some of that or make things more checks and balances, to where you're obviously informed consent, things like that when you're doing certain things. And then also following up. I think a biggest piece to a lot of different work is like people aren't following up with what they said they would do. There's no follow through with it. And so being intentional about that, because we can obviously be Black individuals working in Black communities and still not follow up. And we're still continuing some of the harm that's been done. So I think the follow through is really, really critical, because people are looking to see if you're going to actually do what you say you're going to do.
What strategies are most effective in addressing HIV stigma? It's amazing that we're here in the 21st century and we're still doing stigma. We're still doing the little child thing.
Yeah.
How do you guys fix that?
One of the conversations, again, we see that people are born with this. I think, and also showing some of the data where we see that people aren't dying from HIV. More people are dying from depression and stuff like that than they see HIV. Being unhoused as opposed to just HIV. HIV is always had a sentence it was before. It creates complications, obviously not taken care of. That's one thing. But the treatment of HIV is so effective and flexible now, where there's injectables for treatment and prevention. So I think educating all of that and kind of reducing some of this fear around it, and also showing that there's a way around it. You can obviously just PrEP for people who are HIV negative. And there's different ways of getting that. And so I don't think a lot of people are having these conversations about how to prevent certain things, but also understanding that and maybe educating individuals about what it's like to live with HIV. Because a lot of our patients are living thriving, fruitful lives.
So, how do you ensure Black LGBTQ voices are represented in policy conversations?
When we are looking to change certain things, especially like, look at the commission or even look at the Black Caucus, we have a list of Black LGBT individuals we reach out to. We have conferences where we have meetings with. Working in a space it's very small, although very vast, it's very small, so people know each other. And so I think connecting and having good relationships is critical within leadership, businesses, obviously healthcare, public health, and knowing who to call in certain moments. But I think having good relationships has helped to call in the folks into the room when you need to make the changes and make the recommendations as needed. So keeping in contact with them individuals during the day-to-day work is critical to pull them in when we talk about policy changes.
So, what partnerships have been most impactful for the Black Caucus?
One, I would say Supervisor Holly Mitchell, again, being a fiscal sponsor for our World AIDS event the last 3 years has been amazing because it shows not just because she's not like an HIV organization or something like that. Like it's a elected official who's showing interest into something that's impacting her district. So I think that's one impactful thing as well. Even different relationships we have with different pharmaceutical companies. When there are patients who are having a hard time getting their medication, we already have a contact to connect with them. So I would say pharma reps as well as other CBOs who are doing the work has been really impactful. I think of a few off the top of my head of like one again, Charles R. G. University and a Mod Institute has been really critical. Some of the work with the Black Caucus and holding space for us, as well as Supervisor Holly Mitchell's office.
So, how do you measure progress in the equity work?
When we no longer keep hearing at the table the same concerns and issues, we see things are moving. When we see that those agendas that we have on a monthly basis, whether it be from a caucus meeting and or a commission meeting, when the subject of that is evolving, we know we're doing good things. Last year obviously was a very trying times where a lot of conversations were on budgets because things were being cut. But historically, when we're having those Black Caucus meetings, we see that we're constantly moving um, through things and kind of moving on from certain conversations, we know that we're doing what needs to be done. We're just kind of doing like a maintenance check to see, are we still hitting the mark here? Are these people still feeling satisfied and heard? Okay, then we keep it moving. So I would say that when we see the agendas changing, we know that the work is being done.
So, the big question, tell us, what does the future of HIV prevention look like for Black communities?
Hmm. That is a big question.
Mhm.
I'd say it looks hopeful. Again, we have so many advances out there, and I think that even recently, as I'm in a social program, I'm also been thinking about some policy specific things I want to kind of like start throwing out there and kind of see how to make certain things happen. Obviously, not look at the cost effectiveness of it all as well. But I'm hopeful because a lot of these resources are free of charge to a lot of the patients. We think of the pill formula prep or injectable. Now we have twice a year injectable shot for prep. That is major. So I'm very excited about that. And I know with the work I was doing in Zambia, I was actually the prep specialist out there. And so hearing some of their questions of what they want access to and seeing that obviously we know it comes out to the States first, and then it goes other places. Seeing that this is what they've been asking for, even though across, in Africa, I think I'm really hopeful about that. So I think it's gonna be good. I have hope. I just want people to understand like there's options out there and have these conversations with providers and providers have the conversation with the patients. So anyone who's sexually active, have you heard about PrEP? It should be part of their conversation off the rip.
Well, we discussed, when we initially had a discussion about you coming here on the show, we talked about we're doing Black History 365. When we chatted, I asked you who were the most influential people in your life and career. You told me it was your mother, Barack Obama, and just people in general. Let me first start with your mother. Can you tell us how has your mother been such an influence and an impact in your life and career up to this point?
She's unapologetically herself. I mean, very high integrity, very steadfast in what she believes in, and also very compassionate. She, for me, is like the epitome, has always been the epitome of like a safe space. And so that's allowed the little boy in me to be very satisfied, to where I'm not having to, as we get older, we start thinking about how do we fill the gaps in certain spaces. I don't have to fill that gap because I feel like she filled my cup very well. And so I think that was a very, very, very healing thing. And so I think even now as an older individual, even interacting with patients and seeing people who have different experiences with like their mothers, it's like I had a very fortunate experience to have a safe space with mine. So it's allowed me to do this work with less trauma.
And so, with your mother being as strong as she was, and how she set a strong foundation for you, what is it about that foundation that you get from her that's made you the individual that you are today?
What I got from the foundation from her to make me who I am today is she was very compassionate with people as well. I mean, she was a Scorpio, so she had a spice side a little bit. But I think for me, she also led with kindness. And so that, that has been very influential in my life now, to where it's like you can have a lot of people in your circle, in your space, but if you're not kind, people will know that. People will be able to tell, like, this is not a nice person. People don't want to be around unnice people. So she was very pleasant and allowed me to also see what the impact of that was in my circle and people who, when I'm not in certain spaces, people still speak very kindly of me because I'm just a nice person. So I think that has been a guiding force as well.
You also mentioned President Barack Obama. Can you tell us what is it about President Obama and that has influenced and inspired you so much?
To face so much backlash for just being who he was, and to still rise to the occasion. We're talking about, to get through 8 years within the White House and not have any scandals and just be very, you're almost forced to be perfect to be the first in that capacity. And so I think the way he was able to do that with such integrity and grace, and obviously, I feel like even without even knowing their personal business, seeing how the family operates, his family operates as a whole with Michelle Obama and the kid. Like, through those, it was very intentional. So, and also how he interacted with, just everyday Americans, I thought was really impactful, to see that, he was so true to himself through it all.
Well, so when you think about those 8 years, and you did say something in there that I thought was really captivating, because a lot of us in our times never thought that we would see an actual black man be president of the United States, but he did it for 2 terms.
Mhm.
And so, with that, tell us what did when you look at the strength and resolve he had to have in dealing with the backlash from those that the people not only on the opposite party but within his party that didn't look like him, that wanted to see him fail, but he succeeded anyway. How did that impact you to be the strong person that you are today?
It taught me not to let people's like outside opinions impact your purpose driven life. There's a calling on all our lives, and I think sometimes if we allow outside influences or people to deter us, that can obviously waste a beautiful dream. And so I think that when you're focused on what you're doing, the outside noise has no impact on it. And so that it's been a driving force. A lot of things I've done, even coming to healthcare, having my doctors like that, and kind of moving in different spaces. There will always be people who doubt you. And how do at the end of the day, it's like, as long as you believe in yourself, that's all that really matters. And having the support system that's authentic to getting you to the cross the finish line is really critical as well. And I saw that with what his journey looked like.
So tell us about the influence of the people. How is it that the people influence you so much?
You I mean, good energy is good energy. And I think that when people appreciate the work that you do, it really speaks volumes. And I think it just shows that you're on the right path. Again, as I mentioned, I've gotten compliments on just like my energy, my aura. And that's like, people always ask, like, what are you passionate about? what kind of job do you want to do? My answer always is like, I just want to be engaging with people. As long as there's people involved with it, I can do it. It could be oncology, it could be HIV, it could be heart disease, it could be behavioral health. As long as there's a way to interact and kind of have these human experiences, that's what drives me forward. Because then you're able to see in real time the people's lives that you're changing. Even those aha moments, it's like, oh, like we're having this really healthy conversation right now, and people are getting different things from it. And that is the work. That is the legacy where people are able to say, well, I saw, Dr. Leon say X, Y, and Z, or when our conversation that really made me think about this. And so I often tell some of the patients, it's like, you may not get stuff from me as a facilitator of this particular group on anxiety, depression, bipolar, but it may be some of the residents and their shared experiences that you may be like, oh, I never thought about that. And so I think being a conduit for that and it's just really
Um,
amps me up
amps me
really
up
to keep
really
me doing
to
the
keep me
work.
doing the work. So, how do you carry the legacy of all of these great people? How do you carry their legacy in your day to day work?
Um, One, I mean, my mother, I have her last name, so that was a major part, especially in my doctorate degree, is like, Maultsby is her last name. So that's, anything I do is always gonna be tied to her. And I carry the legacy of like Barack Obama, which is still, as we know, with this most recent opening of the presidential center, is still very thriving. And so just trying to make sure that I am almost doing things that make obviously individuals like proud, if you will, like my mother proud, and stuff like that, and living in those same footsteps. And obviously knowing that my reach may be different than President Barack Obama's, but like I could do things in my own small way in my own community to also make a lasting impact. And so let that be the driving force. And also having the wherewithal to know that I don't know where this path is going to end. I may be the first, you know, black gay president. Who knows? But I would know that these people have paid the way, and almost similar to how Oprah always talks about, I stand on the shoulder of giants, and that's really real. Like we're not just individual in these spaces. Like we're all a community. And I think as you think about people who've influenced you, like you take them with you every step you go. So when I'm in certain spaces with patients or in the caucus meetings like that, I'm not showing alone. I'm also showing up as the ones I've interacted with over the last few decades.
Well, I want to make sure I mark that down on this sheet. That Dr. Leon Maultsby is going to be running for president. He's going to be president of the United States in 2035.
It may happen. It may. Listen, I'll
Oh,
write
look,
it
that's
off.
true.
You heard it
Exactly.
here, folks.
So in closing, what are some words of wisdom and encouragement that would you like to leave with our audience? Tell them how to connect with you via social media, your websites, all the good things you got working about, coming about, anything that you like them to know.
Yeah, I would say one quote I love to always throw out there. I know she wasn't the originator of it, but she often says it often. Dr. Maya Angelou says, "I am a human being. Nothing human can be alien to me." And so I think that just shows that we're all but one moment and one situation from someone else's experience. So as they're sharing their experience, understand like we're just all humans in this, this thing called life. And so not to judge or stigmatize or, push people away because of their different moments with it. So be kind and give grace for that moment. Um, Things to follow for me. I do actually have a mental health page as well. So Black Man's Guide to Mental Health is one of my Instagram pages, as well as Dr. Maultsby, where I post all the different things that I'm doing in relation to mental health, and or a lot of the community work that I'm doing is on the Dr. Maultsby page.
Okay. Well, when I close the show, do you have a few minutes to stick around after I close?
I do.
Okay. I'd like to thank each and every one of you that's watched the show tonight, that's been with you for this duration. I hope you guys learned the importance of community because the work that Dr. Maultsby does, as well as the impact that this is having on the community, serves as a great purpose for all of us to want to do better in our communities, to build them and to make them what we want them to be. So therefore, as he said earlier, be what you want to see. In closing, tonight's conversation reminds us that equity is not an abstract concept. It is a daily practice, a moral obligation, and a collective journey. Dr. Leon Maultsby's work shows us what it looks like to lead with courage, to teach with compassion, and to serve with intention. From global health to local advocacy, from classrooms to community coalitions, his impact is a testament to what happens when expertise meets heart. His story challenges us to confront inequity, uplift community voice, and build systems that honor the dignity of every person. This is the work. This is the calling. This is America in Black and White. I'm your host, Charles King. We will see you guys tomorrow night for another great show. You all have a great evening, and we'll see you next time.